there, and welcome to Yas and Sam's in the waiting room. I'm Dr. Yas, and the other doctor is Dr. Sam, and today we're going to be talking about hives. Okay, so many of you have probably experienced hives. Hives are basically when you get a red wheal on your body, and it's basically raised, it's itchy, and the center is pale. Okay, so that's called a hive. Now, when you get these hives, they usually start like within 24 hours, and then they only last 24 to 48 hours, and they're always moving all around your body. So every 6 to 8 hours, you might notice a new hive and a loss of another hive. Okay, and that's a typical acute urticaria. Acute urticaria is urticaria that resolves within 3 weeks, and it's usually secondary to a toxin, such as something you ate or something you're allergic to in your bed sheets, in wool, in your blankets, in the air, maybe a plant. It can also be secondary to viruses and parasites, so that's really important to know too. So usually allergies or infections and irritants are the reasons you get acute urticaria. Now, acute urticaria can be scary because it can be associated with asthma and angioedema. Asthma and angioedema both can block your breathing tube, so that can be lethal. Angioedema basically is just swelling in your breathing tube, so be careful, okay? If you do have hives, take it seriously. You probably have seasonal allergies as well. Go to your doctor and get the full medical evaluation, and they'll rule out asthma and angioedema. Now, what happens when your urticaria occurs for more than 3 to 6 weeks can be extremely frustrating, and maybe you don't know why it's occurring, okay? So what you have to do then is think about other things, okay? So the intermediate form of chronic urticaria is called cholinergic urticaria. And cholinergic urticaria usually occurs at the pressure points on your body. So if you're wearing a bra that's a little bit too tight or you have a tight belt around your waistline, that's where you'll get these hives and you'll get inflammation. Sometimes it's related to acetylcholine, but it's really right because mast cells in your skin are releasing IgE and histamine. So again, using an antihistamine drug can help you manage the symptoms, but you should go and get a full medical checkout because it can be associated with a lot of other medical problems. Okay, so that's the intermediate form of urticaria. Now, the chronic form of urticaria is when you get random hives all over your body and they just don't go away. There's no trigger associated with it and you don't know why you're getting them. This is a medical concern. You need to go to your doctor and probably go to your internist to get a full medical evaluation. The reason being is that this is not related to toxins or allergens and whatnot. This is related to usually either an underlying autoimmune condition like rheumatoid arthritis or lupus or any of that spectrum, or it can also be related to Hashimoto's thyroiditis. There are other causes for chronic hives like parasites, psychogenic, and unknown, idiopathic, okay? So we have to be really careful and we have to make sure we work you up completely, okay? Now, when you see this chronic form of urticaria, there are different ways to treat it. First line of treatment is always an antihistamine. So the first kind of antihistamine is the kind that you take for your seasonal allergies, like Hismanol or chlorotripholon. If that doesn't work, you can also use an antihistamine that you use for stomach problems, like ulcers, such as cimetidine. So cimetidine and chlorotripholon will both be used together to get a better antihistaminic effect. There are different types of histaminic receptors, and the stomach and the seasonal allergies form of antihistamine will help you get a broader coverage of histamine receptor blockage for your urticaria. Now, if your antihistamines are not working, you can go to the doctor and get a stronger antihistamine like hydroxyzine. If that doesn't work still, we can consider anti-asthma drugs like leukotriene antagonists like montelukast, okay? Those help just with inflammation within the skin. If that still doesn't work, you can try drugs such as dapsone and corticosteroids. If that doesn't work, you go to immunomodulatory drugs. We think more of like you have an underlying autoimmune disease, so we kind of have to knock out your entire immune system. And that's when we use medications like cyclosporine and methotrexate, okay? Finally, we also have to think about supplementing your thyroid hormone with levothyroxine because if you have Hashimoto's thyroiditis, you'll have anti-thyroid antibodies, and that will make your thyroid hormone less. Giving you thyroid hormone will help your skin reduce its inflammation and reduce the hives. Finally, there's a huge grab bag called idiopathic, which means we don't know why it happens. So if you're still getting hives and we've done a complete medical analysis and we don't know why, then we'll take a biopsy of your skin to try to figure out what is going on in your skin. What are the triggers? Probably take your blood as well to find out what your white blood cells are doing and how they're functioning and what they're responding to. So that's basically asthma urticaria in a nutshell. Make sure you get worked up for both asthma and angioedema because those can be life-threatening. Bye for now.